Hello, my name is Ali Kelly and I'm the CEO and founder of MindBlank. Welcome to this recording series. Before I get started, I just want to acknowledge the traditional owners of the land in which we meet today, elders past, present and emerging. I am actually recording this from the Jagera and Turrbal people here in Brisbane. Now, I'm here today to be able to share some really important information with you all. Who am I? My background is actually psychology as well as creative arts. 10 years ago, I started the MindBlank charity, and what we do is we empower people to be proactive about building skills to also put in place mental well-being strategies in schools, workplaces, and in the community. So far, we've hosted hundreds of workshops directly impacting over 40,000 Australians. We're here today to be able to share some insights with you all. Now, why am I here? Why are we doing this presentation? In all honesty, it has been heartbreaking working with children and young people during this pandemic. And some of the stories that we're hearing from schools and teachers has been really heartbreaking. What I wanted to do was share some knowledge and insights, particularly directed at school leaders. What we can do is it is in our control to go from crisis response to steer the ship towards prevention. And that is what our organisation is really good at. We're just going to be sharing some basic insights with you. There is a workbook that you can use to go along this journey together. Now, I'm here to be able to provide some course content, but this is only 1 hour, which is a really small snippet of some of the professional development opportunities that we have for school teachers and school leaders. I just need to make sure that you're all aware that this is not mental health first aid training. There will be schools that are listening to this from various different districts and departments from different states and territories. And look, the Department of Education will have some standards of practice when it comes to crisis response in some states, and it may not have as well defined practice in other states. We're not here to confuse you or contradict any of those regulations. We're just here to share some insights as to what we've been doing in workplaces, how we've been helping guide organisations during this pandemic, but more so in particular, how we can help support your students. Now, this roadmap for help will be 3 primary foundations that I'll be focusing on. The first one being mental health literacy. So some of the signs and the symptoms that we can see that can help equip yourself as school leaders to know what those signs are. The more we can define some of these hazards, the more we can help guide teaching staff to know what these hazards are before they're hit with them. Therefore, it gives them more clarity to know how to respond. I'll be talking a little bit about setting up a wellbeing culture, as well as supporting educators with mental health and wellbeing needs. The Department of Education, the education sector, the health sector, we are seeing some really overwhelmed workforces. There's quite a lot of burnout going on. And to be able to avoid that burnout, we really need to be able to get off that treadmill of I'm too busy or I'm reacting or there's so much going on. The sooner we do step off that treadmill, the more we can be proactive about planning for a prevention strategy. When we're on this treadmill of busyness and there's so much going on that our adrenaline is kicking us into fight or flight, and what we're doing to ourselves is there's that potential to reach burnout 3 times faster. So it's really not healthy and it's only really reactionary in the short term. So we need to be able to plan for long-term wellness strategies. Now, some of the guidance for this roadmap, you'll see there's 2 resources, and I will make sure to share this PowerPoint with you all, but it's actually coming directly from the Mental Health Commission. They have a roadmap, a national strategy for children's mental health and wellbeing, as well as some points from the Black Dog Institute about this transitioning into the workplace post-COVID. I just wanted to point out that what I will be talking to you all about, it actually fits under work health and safety legislation. People conducting business or the employer, it's their responsibility to make sure that their workers are safe and not put at risk. And if risks do come up, we need to be able to eliminate those risks. And there is, of course, some responsibilities that goes out onto individuals as well. Individuals need to be able to know when it's safe to intervene and when it's not safe to intervene. But I'm talking to you today from this legislation standpoint. The material that I'm covered today goes hand in hand with work health and safety, mental health and wellbeing policies. And if your organisation or school doesn't have wellbeing policies, there are actually some templates that I've provided in the workbook that you can look at. Go to page 5. There's some great examples. If you just do a Google search, you'll be able to find some great examples that are made publicly that helps to embed a culture of wellness. So this prevention training that I'm talking about today actually goes hand in hand with how to design that preventative culture. All I wanted to point out in these next 2 slides is the fact that today we will actually be speaking about aggression that is coming up with our students that can end up being violent, that puts our teachers at risk of the backlash. There have been many cases of this aggression and violence leading to work cover cases, and it is horrific to handle. If left untreated, it can lead to chronic stress, and some of the chronic stress symptoms are included here, and they're also listed in the workbook on page 6. We need to be aware of these signs turning up in staff because it is not healthy. And if left untreated, it can actually lead to some pretty severe mental health issues, which could lead to very long-term time off work, more stress in the workplace if left untreated. So that's one of the reasons why I'm here today. Is I'm aware that some of this is happening, and let's actually shift the focus to build some skills to know what to do so that we don't have to keep going from crisis response. The scenario I want to just chat to you today about is actually, it's a real life scenario. So what MindBlank does, a lot of our programs involve telling stories of lived experience. We work alongside the local health district to tailor some of these stories, because what we don't want to do is trigger the general public when we're hosting any workshops at all. But what we do is these lived experience stories really did happen. And we hire professional actors, and the professional actors play out the stories. And then what we would do in a workshop situation is we would ask the team in front of us what were some of the signs they saw in these storylines, because we can start to identify where the mental health issues started to develop. We also want to be able to guide people to know what those help-seeking pathways are and what some action steps are so that we can avoid that outcome from happening. Now, the scenario that I'm presenting today is a scenario that actually happened in a primary school setting, but it's actually very common that could be well placed in a high school setting as well. So after lunch, the students settled back in. James, who was a student that was already flagged for potential aggressive behaviour, he was just minding his own business until suddenly he grabbed the head of one of the other students and slammed it onto a hard floor. Sarah, who was the teacher at the time, reacted by evacuating the whole classroom. But in doing so, in trying to intervene with this student, she was physically attacked and ended up on work cover. It ended up being a very traumatizing situation for all parties involved. So you'll see in the workbook, page 11, we've presented this scenario. So what MindBlank does through part of our training that's a little bit unique and different is we will guide you through tactics to know what to do in these times of need. But we actually use this creative medium to provoke discussions and to problem solve. Often what we want to do is be able to guide people through the scenarios, but also proactively work with the school groups or the teachers involved to talk through strategies that may work for your school. because some tactics may work in one instance and may not work in another instance. But look, I'm not going to be able to personalize specific scenarios at this point in time. It's just a very short gesture. This course is a very short gesture, but let's talk through a few potential situations that we can intervene with to change the outcome in this high-end scenario. So let's start with what the school can do. So often what we're trying to portray in this actual scenario is that the teacher was caught completely off guard. What we are seeing when it comes to mental health issues popping up and presenting in schools is some really high-end complicated scenarios. For example, a student self-harming in front of themselves, in front of the whole classroom, where there's teachers flabbergasted and just caught off guard and not quite knowing what to do. One of the very first things you can do, and Mindblank is here to guide some of that journey, is identify what these hazards are. What are these psychological hazards that are likely to occur in a school setting that your staff need to be prepared for? And if we can actually define them up front, then we can start to paint pictures as to what those action steps are that you want to guide staff to do if they present themselves. If you do not have a level of code of conduct around this hazard being client aggression, student aggression, then your teachers will feel lost and fumble through the process. And no doubt many have gained some fantastic skills on their own during their work career, picking up naturally gut instinct, some skills in knowing how to prevent with these high-end needs. But as a school leader, one thing you can do is be proactive with putting out some of that knowledge early. So the school could have certainly have educated some of the staff on some work practice policies when it comes to student aggression incidents. The school could have equipped its staff with the knowledge, with the identification of what some potential mental health issues could be. The school could have offered a safe space for teachers to discuss early intervention and mental health actions to avoid reactively responding to mental health crisis that could present in a classroom. Knowledge on the student, what was happening for the student, and that past history of that individual could also help assist that teacher with that particular scenario. I haven't told you the full details, or we haven't told you everything, but in this little snippet, if there was knowledge that this student has prior aggression incidences, that could be very helpful knowledge to pass on to the classroom teachers. But also from a prevention of early intervention of mental health issues, what we can do, knowing that we've just had a pandemic, one of the reasons why some of this aggression is coming up is I completely understand it's not new behavior for some. Majority of students are actually transitioning really well, but the frequency of some of these incidences is happening more and more. And part of that, it goes right back down to the student's psychology. Needs are not being met. This aggressive behavior is popping up and manifesting because they're trying to get the attention of a trusted or respectable adult. And what has happened is it's manifesting in the wrong way and is absolutely inappropriate. But we need to be able to figure out what is going on underneath all of that. What is the student not telling you? Because there are red flags that could be presenting that's coming out and manifesting in this way. And the more we can kind of delve into understanding what that student's needs are, building that rapport, building that trust, the more we can unpack the layers of complexity that's happening. In an instant, often when this challenging situation happens, it is easy to be emotional, it's easy to be reactive, and it's easy to punish. It's easy to come from that discipline perspective. But in this time of post-pandemic backlash, I don't know what you want to call it, that we need to be kind and we need to, tune in rather than time out, Tune into what is happening with that student's needs. How well do you know that student? How well do you know the trusted adults around that student? What is going on for the individual? Because if we can pinpoint how to build trust and rapport with that individual, we may have a chance at turning it around. Early intervention of mental health practice shares knowledge of spotting the signs, knowledge of understanding that concern, worry, trust, and what resource support there may be to support children if they are experiencing mental health issues. And one of the things that we are seeing in this contemporary world is one of the teachers, for example, had shared with me in Victoria, yes, online learning, but there are students presenting in class that are on suicide watch, and it's making the teachers really nervous, because it's great that they're aware of this child's situation, but what has happened is the waiting lists to get on to see a mental health professional can sometimes back up. And in that particular scenario, there's a 6-week waiting list before we can get that young person to see someone to be able to address those needs. So if we know these mental health symptoms are starting to pop up, one thing we absolutely can do as a school leader is help equip teachers with some of the basic knowledge of early intervention practice. One thing we can do is make sure that every single teacher knows what those pathways are if these mental health issues are presenting, to know what to do in a time of need. Even if it's not happening at your school yet, and touch wood, I would love to hear that, that there are students and workplaces transitioning really well, but we need to actually prepare on the days that it's going well for these high-end scenarios where it may not be going well. Tactics for the classroom. So I was just sharing what a few things that the workplace could do. And I apologize for some of the typos on that page. I did make sure that I wanted to put that information there because it's really vital. Let's look at tactics that teacher in that scenario could put in place. In that reactionary space, if they're not told what to do, they're going to organically do what their gut instinct tells them. And if it wasn't painted, if there wasn't a procedure painted for that staff member, then naturally their instincts could be to, clear out and safety first, right? Get everyone out of there. One thing the teacher can do when confronted with aggression and violence is get control of that fight or flight and remain present. Try and respond with calm in a respectful way. Now, whether it's responding to early intervention in mental health, like I've got an instance and it's a crisis and I need to deal with it now, or whether it's responding to something that has kicked on their fight or flight, with practice, the better we'll get. And that's why it's important to prepare the teachers for these instances, because the more you can prepare them for these scenarios, the more they'll feel well versed when that scenario pops into place. So practice calm, and many of the schools may have some mindfulness already built into some of the practice you're doing with the children and young people, but we also need to be practicing it as teachers and school leaders. What they can do is be super mindful as to how their body is presenting or what they're saying to the children. I've heard feedback, some horrific feedback, where sometimes teachers are going along with, let's say it's a bullying incident, and they're reinforcing some of the negative labeling onto that child or young person, and it's completely misunderstood. We need to be able to build these social skills up so that there is trust and rapport built with the child and the adult. I know there's some intense scenarios going on, but it's fantastic if we can build allies with our school teachers. We need to be able to avoid some of that power play, which can be hard because the teaching role, of course, is that disciplinarian role. We need to be able to find a way to empathize with the aggressor and what's going on, get them to talk, listen, be genuine, authentic. build respect. Now, my other suggestion that I will share with you all is one tactic I am helping support school leaders with is, if you know that there are students coming back into your classrooms that could be experiencing mild aggression, or it could be that they could be struggling with anxiety or other mental health challenges, one thing you actually can do is certainly build awareness from a staff perspective as to what those signs and symptoms are of that particular mental health issue, because it's really helpful. For example, let's pick on anxiety. If someone is confronted with a panic attack straight away and they've never had to deal with it before, that's a huge stressor on staff. If they don't know what to do, that's another big stressor. But with knowledge, they may be able to see some of the signs and symptoms of a panic attack building up. And they may be able to have that insight to see, with a panic attack, it may feel completely overwhelming, right? And what the body is actually doing is trying to kick oxygen back into the brain and self-regulate the whole situation. So although it may feel life-threatening to that individual, it's actually rather harmless in comparison to some other intense scenarios. There are some clear things that you can do to guide students through these panic situations, a lot of them involving grounding techniques, mindfulness techniques, and breathing. And if you're equipping your teachers with some of those skills before it even happens, it's a fantastic thing to reinforce. So with this client aggression scenario, if you know that there are students showing signs of potential aggression, there are ways that you can build in really small mindfulness techniques or tactics within the classroom. And you don't have to necessarily isolate that one individual that could be going through that, but it could be a way to get back self-regulation, to get the entire class to be able to focus on it, because it may be a way that you can build some of these skills subtly to help lessen some of those severe or intense situations coming up. So look, this topic is something for you to discuss with your teachers and your school, because other suggestions could be what actually works for your school. Are you active in defining it? And are you active in clearly being able to guide steps with A, B, C, for example, action steps for them to take if this particular scenario comes up? What are the mental health red flags that could be showing, that could have been manifesting from some of that aggression? I want to just share that in the real life story, what happened was the teacher did actually pick up some of those signs subtly. And the teacher did actually pull aside that student to have a chat. But the teacher wasn't really that good at communicating with that young person. And the teacher wasn't really that good at building trust. So often what we find, particularly the teenagers, not necessarily the primary school children, but the teenagers build up all their courage to sometimes ask someone for help. And if that pathway doesn't go well, they can just give up. That's it. It's not worth it. I'm here on my own. And teachers have a great role to play when it comes to some of these initial talking points, these initial building trust, because if you can crack in and build trust with that individual, then they're more likely to be able to go to you. You're more likely to be able to spot some of those signs as to when it's going all right and when it may not be, or where it's spiraling down. So there's some suggestions on page 14, and no doubt this list could be endless. And for any of the teachers that have gone through actual mental health first aid training, there are more specific ways that you can find out the various different mental health, mental illnesses, for example, and some of the signs laid out specifically depending on what they are. But just here's off the top of the head, the red flags the teachers really should be alerted to if some of this behaviour is coming up. And it can be very simple. You know your students, and if they're appearing a shift in personality that's different beyond students' usual fatigue, you know, there could be things underneath that. How is their self-esteem and how is that level of progression going? What is going on? Like, have you picked up any past issues, grief or loss? What is on the forefront for these students? Unexpected behaviours could come from drama, action all the time. There could be ways that you could see subtle signs of weight loss or weight gain, personality shifts, the various different levels of complexity that could be hiding other things behind it. Serious self-harm, of course, fear that could be arising, or panic attack, anxiety, involvement in hurting others or fighting. Where are they learning this from? There's been huge issues of domestic violence and community with closed doors, with lockdowns. What are you going to be seeing within your classrooms? How are you going to be equipping your teachers with some of this knowledge? Extreme difficulty concentrating, physical danger that could be presenting in these classrooms. And no doubt you could all actually list your own lists of what's going on within your own working environment, within your own school setting, of signs that you've seen before. So far, quick recap. Mental health literacy. We have covered some signs and symptoms of student aggression that could be underlying undiagnosed mental health issues. We have started to talk about setting up a wellbeing culture, setting up from the top down, where we are able to start with things like defining mental health and wellbeing policies, where we can be proactive about what potential hazards in the workplace are coming up, clearly outlining the pathways that you want your staff to follow, because that is going to steer the ship from crisis response into that prevention space. Just want to quickly talk to you about an early intervention mental health framework. If you do have mental health policies in your work environment, you would have your own version of this. If you have taken on the mental health first aid course, you'd be aware of some of these steps as to ALGE. But every single individual or community citizen should really be aware of some of these steps. So just very quickly, what you can do if you notice that a child or a student is presented with mental health concerns, notice those signs. Share your concern with the individual. Provide resource support. Now, that's going to look different in every single school environment, in every single geographic location, no doubt. But provide resource support. So have some numbers on handy, or have some quick people to go to be able to support that young person's well-being. If it gets worse, you may need to support intervention, and school leaders, you need to be really clear with knowing how to support intervention. What does that look like in your classroom? What do you want your teachers to do? Because one of the steps, if you go to step 6, avoid accidental counselling. What we're finding in this education space is high levels of burnout. There are lots of teachers that care a lot about their students, and there's some pretty high-end environment situations going on where students could be presenting, for example, with domestic violence in the household, or maybe they're presenting where they're challenged because there's no roof over their heads and you have to deal with all those levels of complexities, or may not be a supportive environment at home. Long story short, to just say, teachers can go over and beyond to try and help support these students' well-being. And what we need to avoid is becoming that accidental counsellor. So what an accidental counsellor is when someone falls into the role of a mental health professional by accident. They're trying to be that support person, but they're not necessarily knowledgeable or aware that they actually could be making it worse. Being that accidental counsellor role can actually delay people from getting the help that they need. It can be counterproductive, because then two people get completely overwhelmed with the situation that's going on, and it actually delays that person getting the help, and then two people may actually end up needing the help. So going back to that step 4, support intervention, what does that look like for your school teachers? Do you want them to go over and beyond, or is there a specific person in your school that is responsible for that? What is the pathway you can paint for those individuals? If individuals are caring and filling in these accidental counselling roles, how can you reinforce to make sure that they're putting on their own oxygen mask first. How can you reinforce boundary setting or a clear well-being plan for that individuals to put their own self-care on to avoid the extra time that's involved with accidental counselling? If they're at risk, step 5, if they're at risk to themselves or others, support help immediately. Now, that's going to look different in each school as well, but you need to be really clear in defining what that looks like for your work environment. Step 7 is great to reinforce, like smashing some of this stigma, right? It's okay to ask for help. You know, yes, the individual needs to know that, but I can actually present with a situation that's too complicated. And if I don't know what to do, it's actually completely okay to say, I don't know what to do. You know, or if that individual is supporting someone in that high-end scenario, it's okay for them to be able to ask for help as well. And step 8, knowing that not acting is not okay. So there are vital roles we can all play as individuals. Where to from here? I want to wrap it up and just make sure that you have some really clear steps as to what you can do as the next step to help support this preventative strategy of mental health issues popping up within your school place. So step 1, if you've got mental health policies in place, fantastic. If you don't, it's time, it's time to put some in place. In the manual, you'll see on page 3, there is a template provided by the Black Dog Institute. It's a great way to reflect on how to support your school staff and leaders in this time. Step 2, host an activity. I've given you on page 16 how to mitigate aggression. So there's some actual tactics that were put in the workbook just to help for those scenarios where the worst case scenario has happened, where there is a crisis that's happened right now, just like the school teacher in that initial scenario that I shared with you before, who got caught in the crossfire of this incident. Sometimes people can ask for help, but in the meantime, they're stuck with it. That's what mental health first aid doesn't necessarily tell you, is like how you may feel terrible if you're in a crisis because your adrenaline is rushing, and you may go and ask for help and do all the steps that you need to do, but you may actually find yourself in a position where you're still waiting for help, and it could take a long time. Sometimes I'm hearing, you know, it can take several hours to get that help. So what do you do in the meantime? So that activity will help just talk through some ways to diffuse aggression. So things like, I know it's a basic, and sometimes early intervention can be so simple, it goes over people's heads, but things like practicing mindfulness, calm breathing, because when that incident picks on, what can that individual as a teacher do, but also what can that teacher help guide other students to do? You know? So there's a few more activities there. Step 3, you can host a session for your school to go over the early intervention mental health framework that I provided, page 17. You may have your equivalent there, but go and review it, because when you transition, this year has been a heck of a year, and next year is predicted to be one too. So make sure you are regularly having these conversations about being proactive to understand what early intervention of mental health support looks like, both from a perspective of a school teacher and the perspective of how to care for your students. Step 4, review page 19. On page 19, I've actually included some other strategies and some of our collaborators too, because there are heaps of things you can do to plan for a wellness culture at your school. We need to avoid this how to avoid burnout type mentality, because we need to instead ask questions like, how can I support my staff? What can I do to make sure that we are not overwhelming them? And what can I do to make sure that we are planning for long-term wellness? If you keep up these questions, you can make a change to your culture. Just really quickly, I wanted to share with you that we do have some professional development training that we can help guide staff with in a real life situation, not an online one. We would actually host professional actors at a school. So we do offer some pretty engaging ways to build skills. But absolutely our bread and butter is in this early intervention of mental health skill building. We help support leaders and managers with training as to how to create that wellness culture. We support individuals dealing one-on-one with the teachers. When you've got an overwhelmed workforce, you're going to be continuing to be in that eye of the storm. So how can we reinforce and double down on our own self-care tactics? We're also an e-safety provider program endorsed by the E-Safety Commission. So we've been working with children and students in the space of cyberbullying, and we're also here to be able to help and equip staff to know what to do, because students are presenting where they're emotionally triggered in classrooms. So it's just great to have a few more reinforced skills on how to handle and support young people even more. Our professional development usually costs about $250 per person for our workshops that are face-to-face or online. What we want to do is this year we are celebrating 10 years in the mental health sector. We want to be able to make sure that schools are equipped with these skills, and we are offering some package deals, the mental health resilience package, which is $10,000 annually, saving a whopping $20,600. We're not in it for the money, guys. We are here to honestly make sure that we have a thriving future for our children and young people. It is horrific to hear that suicide is the #1 leading cause of death for young people. We're aware that in these regional areas, our children and young people are up to 60 times more at risk. And our First Nations, Aboriginal Torres Strait Islander community, there are some places where our children are up to 8 times more at risk than their non-Indigenous peers. So I'm more than happy to share with you like a 10-year history of wealth when it comes to working with children and young people in a school setting. We certainly do cover a suite of programs, and if you go to page 19, you'll find even more information about what we can do to help schools and children build some of these early intervention skills themselves. That's it for me. Please stay in touch. If there's anything that you've heard today that is absolutely new, then we've done a good job. Some of this early intervention space, we just need to be mindful that it does sound really basic, just like work health and safety stuff. It's common sense, but I'm so passionate about wanting to be able to support the future generation of our children and young people. I know firsthand what it's like going through some of these complicated situations. I am here to take any further questions, queries, or concerns that you may have. I'm looking forward to staying in touch, and I really do hope that you've found some value in the program that we've just run for you today. And I look forward to sharing even further information with you all as time progresses. Thank you for your time. Really appreciate it.